Hear from the panel, Evidence to Action, Safety of People with Disability. What research and evidence would genuinely shift safety of people with disability in policy and practice, and what is currently missing? What needs to shift and where research can help? Because improving safety is not just about generating more research, it's about understanding what kind of evidence decision makers can actually use and what helps drive reform in practice. We've brought together 3 senior leaders who are working directly in policy, regulation and system oversight, all areas that play a critical role in the safety of people with disability. Content warning. This video includes discussions about harm, abuse and safety for people with disability. Some people may find this upsetting. Please take care of yourself while watching. If this raises concerns for you, you can find support here at www.ndrp.org.au, head to our resources and then find support page. Introducing the panel. Natalie Wade, Associate Commissioner, NDIS Quality and Safeguards Commission. Hope Paisley, Deputy Director General for Strategy, Policy and Legislation at the Queensland Department of Families, Seniors, Disability Services and Child Safety. And Luke Twyford, Chief Executive and Principal Commissioner at the Queensland Family and Child Commission. Introducing your hosts, Mary Sayers, CEO, Sue Tape, Deputy CEO and Head of Evidence to Action. Where systems are falling short. Why is that? What kind of research do we now need that will actually lead to safer systems?
We've had a Royal Commission into this topic. We've got state and territory inquiries, multiple inquiries. We've got commitments under the Convention on the Rights of Persons with Disability. We've got system safeguards and investment in trying to prevent harm. And we do have a strong body of evidence. Yet people with disability are still not safe. And so we invited you today as key system leaders, and we encourage you to be frank. From a policy and reform perspective, where do you see the biggest disconnect between what we intend and what actually happens in practice?
Thanks, Mary. When I think about policy relevant research and where there is potentially, you spoke to earlier, the disconnect between potentially sort of evidence and then evidence into practice. I think that's where the biggest harms come from, not having research that is necessarily cognizant of the policy settings in which research might need to be implemented. And so I think the harm and potentially unintended harm and unintended consequences come when there is not consideration before embarking on research about the environment in which research might be implemented. And so the sorts of environment that we're in both nationally and at a state level is certainly an environment which is rich with lots of information, and I use information loosely. So you've articulated many a commission of inquiry and Royal Commission. We've had an NDIS review. We've had a lot of consultation about a range of legislative reforms. And so the environment and information is rich, but what happens then when harm comes into play is where there is a disconnect in translating that research into policy and program design. And so research that gives consideration to the environment in which it's being intended to implement, I think is research that's well considered.
It's a really interesting question, as often you will pose to me, Mary and team, about really what, from a regulator's perspective, do we see systems falling short? And I guess at the outset, I can't quite get past the reflection of considering what are we regulating when we consider the safety and human rights of people with disability. I think it's really important in all of our work when we are endeavouring, as we all are, to advance the rights of people with disability as articulated in the United Nations Convention on the Rights of People with Disability, to think very thoroughly about where it is appropriate to regulate and what that actually means. currently in Australia, of course, and from a Commonwealth perspective, we predominantly seek to regulate the delivery of services. But that accounts, of course, and I should say, although I'm sure it goes without saying, the delivery of services as provided through the NDIS. But that accounts for about 780,000 people with disability out of 5.5 million people with disability in Australia who identify as having a disability. And so it does leave me sort of wanting to be very clear with the research community about the role of regulators and regulation when we talk about the advancement of the rights of people with disability. But from the perspective of a regulator responsible for the disability services market, a salient issue where systems fall short is visibility of where and to who services are provided. So it is very difficult to properly advance any sort of safety, proactive or reactive measure if you cannot see who is where and what they are doing. That need for visibility for a regulator is central to our efficiency and our effectiveness, but it presents some really interesting issues, which I think this community will be well placed to think through, and that is around the nexus between what should and can the regulator see and what can and should we regulate to properly advance the rights of people with disability. And in that nexus sits some really interesting, very researchable issues around privacy, around the role of a regulator. So when we think about, well, if we can see it, what does a regulator then do? Well, we either educate or we take compliance and enforcement action. Principally, they're sort of the three ways in which a regulator will respond, be it proactively or reactively. And so how effective or appropriate is it that a regulator would do that, even if it is in the spirit of safety and advancing the right of people with disability to, in the vernacular of the UNCRPD, to live free from violence, abuse, neglect and exploitation. Now, in my work at the NDIS Commission, responsible for NDIS provider regulation, that's a reasonably easy philosophical question, because service delivery is paid for through the NDIS. There are important elements of accountability and transparency that also present really central expectations that people who purchase services with their NDIS funding will receive quality and safe services. And so, of course, as the regulator, we want to be able to see that. And there's important conversations about mandatory registration. And then when we see it, we want to respond to it. And there's another conversation, again, a very researchable conversation about, well, what is the effective regulatory response that advances the rights of people with disability. So,
and over to another, I don't know if you would call yourself a regulator, Luke, but you have a different lens in terms of you start with children and families who may or may not have disability. And I guess from an oversight perspective, how does the things that Hope and Natalie have been talking about show up across the systems you monitor, particularly from in terms of accountability? And that kind of goes to the heart of Natalie's words as well.
I want to build on what Natalie in particular has said and also what Hope has said. I am a regulator of Queensland's child safe organisations, and that's being introduced and takes full effect on 1 July later this year. I'm also the chair of the Child Death Review Board, and over the course of the last 5 years in this role, I've reviewed over close to 2,000 child deaths in Queensland, 70 of whom were known to the child protection system. And I lead reviews into the child safety, blue card, early childcare, police, youth justice systems here in Queensland. I think to answer the initial question in the most sharpest way possible, and you did ask us to be blunt and slightly provocative, I think too many government services and systems, including my own role, falls into the trap of becoming transactional around individuals. So in reviewing the death of a child, I review a one-off incident or a one-off case. I see that in service delivery. I see it in how we create safety plans around a child or a support plan around a participant. And so in thinking through how can I in an oversight role, but I'd extend it to how can researchers help systems, it's how do we lift out of a world that has become increasingly transactional to the individual and start to put the lens on, we all live in families, in neighbourhoods, within communities, and our safety is defined by our external context, not the individual system that has a touch point with us. So I think that's a really important first point. Attached to that is my second strong view, and that is that safety is not simply the absence of abuse or danger. Safety has to be more than that. The incredible Australian child maltreatment study told us that emotional harm in childhood is as significant as physical abuse. So that really says the way we treat people, the way they feel valued, how they have an understanding of self-worth and connection, utterly defines safety. And I think in conclusion to your first question, too often I'm asked to look at when things have gone wrong. A critical event has happened, children have been abused or children have died, and I'm asked to go in and understand that case study and to work out how policy should change or how procedures should change. And so I'm responding to safety failures. What I tried to do in my In Plain Sight report most recently was actually lift out of that and say, who is the society that Australia should seek to be? And within that society, how do we prevent harm? How do we respond to possible detection of harm? And make that more important than how do we respond to allegations that harm has already occurred. Not saying it's unimportant, but saying we might have our balance wrong. And then finally, a new fundamental bit in that review was really, well, how do we recover, heal, and learn from harm? Too often systems will do the very obvious, let's investigate this case, let's write a report, let's make 15 recommendations, and as you said at the start, then fail to implement and fail to be held accountable. So what's the long-term whole of society or whole of system approach to learning and continuous improvement that can lift out of incident response or crisis response?
Where evidence is falling short, where are the biggest gaps in the evidence when it comes to safety today?
In terms of where do you see the biggest gaps in evidence when it comes to supporting policies and decisions on safety? And I know you know, in terms of really fast policy cycles as well. The context of making policy is rapid as well. So I guess the gaps of the evidence when it comes to supporting and how we can have really timely evidence to help with policy decisions.
Thanks, Mary. It's Hope speaking, and that's where I'll start, Mary, is in that space where policy does move fast. So some policy can move at what feels like a really slow pace, but I think where policy moves quickly, there is need then to draw on readily available evidence. And so often there can be a disconnect between when research is available, when it is policy and context relevant, and where it is able to be used for policy development. If I think just of my own observations, and in recent times having shifted from being in a Commonwealth environment where much of my considerations are at a very broad national perspective, where we're a federated country in which there is diversity everywhere, and coming into a jurisdiction like Queensland where it is very diverse, where it is geographically dispersed, where we have lots of different settings in which services and policies and programs are delivered. That gives a real shift in the way in which I think about policy and the way in which I potentially use research to inform policy. And so I think in those instances, what is really useful for me, I find, so flipping around in terms of, not necessarily talking about a gap so much, but I think understanding and having an eye to what works for one cohort and what might work at a national level doesn't necessarily speak to what might work within an individual jurisdiction. Jurisdictions aren't the same. Certainly, we like to share amongst ourselves and others to learn, and in different areas we're often grappling with a very similar issue or challenge, and we can learn from that. But what I've observed in a state government role in particular is that we're often much more closer to the lives and sort of making impact of people, and a lot closer to that than you might be sort of in a Commonwealth agency. And so being able to have an eye to the really practical implementation of research, particularly in a state context, being able to have an eye to systems and research that can support a range of different cohorts in the settings in which they are, and acknowledging that there is difference and diversity, and that provides opportunity to think differently in different settings and for different cohorts. And so research evidence that considers those sorts of gaps where you can look to reflect the diversity, I think is research well worth doing.
Luke, over to you. From your lens, where is evidence not giving us a clear enough picture of how systems are performing?
There's a big question. I think we're in this world where there is a lot of data collected, data, evidence, views, and research. I find it hard to synthesize all the information into a very clear what needs to be done. My team each month do a sector insights paper where we look for the headline child and family related research journals that have been published and translate each journal article into a one-page summary and then produce that. And even then, looking through what we've summarised down, there's this wealth of information. And the challenge for us is, well, how does that translate to a clear communication to the powers that be, whoever they are, about what needs to change? I've certainly found that the voices and views, lived experience, is incredibly impactful in driving change. And so I have learnt in advocating for system improvements that research must include or be associated with the voice of lived experience, and that without that, it gets very hard to to open people's eyes who aren't naturally attuned to research. A lot of people in policy decision-making places and political positions are looking for the answers and the actions, not necessarily the evidence. And I don't mean to be obtuse and rude to anyone, but it's a fast-paced world. There's lots of information swirling. There are 1,000 agendas being played out in public narrative. What do I need to do? Where can I find the information that backs what I need to do? Let's go. And then separately and almost contradictingly, there's a real sense within systems that they are fine the way they are, and actually you have to prove to them the benefit of a change. And if I talk about Queensland's child protection system briefly, where there are or where there is significant overrepresentation of children with disabilities and children whose parents had disabilities or have disabilities, that system is one where no one would rightly say it's working well or where it's working as intended. But you do have to bring a mountain of evidence to get it to change. And so systems get stuck doing what they're doing, and you've got to prove to them why they need to change. I'd love, from some systems, for there to be more recognition that we need to change. How do we do that? And I think a deeper part of your questions here is really, what research do we need? My current passion project is, why can't systems transform themselves? There are thousands of recommendations with good ideas. Why can't a system self-improve?
Recent conversations, we heard that systems in themselves are so complex that sometimes biting off a part of the system that could change rather than the whole system. So that was an interesting thought that I hadn't thought about before in systems change. Often we think about the whole of the NDIS or the whole of child protection. And so that was an interesting observation that I had recently, that, it is hard. Systems change is really complex and really hard, but absolutely warrants much more research. Natalie, I might go.
Where evidence is falling short. What gaps in data or evidence are making it harder for regulators to identify patterns, act early, and ultimately eliminate restrictive practices?
Gaps in evidence or data that make it very hard for us as a regulator to properly respond in terms of acting early or ultimately achieving strategic and statutory requirements, such as the elimination of restrictive practices, is a few connected pieces. One is, as I mentioned, visibility. It's very hard to have patterns identified or to be able to act early when you can't see what is happening. In the case of restrictive practices, this is very well illustrated in the difference between a registered and an unregistered provider. So registered providers, so at the moment, if I go back one step, not all NDIS providers are required to be registered, and there are areas of support that are required to be registered, and there have been NDIS review recommendations made by Bruce Botterhaney and Lisa Paul's work, and then I led a task force after that on mandatory registration, exploring what that could look like for the scheme. But as of today, there is not mandatory registration for all NDIS providers. So as the regulator, we have both registered and unregistered providers, all of whom are required to comply with the Code of Conduct. But only about 6% of the whole market is registered, and we can see. When a provider is registered, and so they're visible to us as the regulator, they are required to comply with practice standards and rules. Those practice standards in particular, when it comes to restrictive practice, require the provider to report incidents of the use of restrictive practice, particularly when they're unauthorised. So this allows us to apply a data-driven approach to understanding when restrictive practices are used, who they're used by, and in what circumstances are they used. But that is not across the whole marketplace. So visibility is really important. It's also really important when we look at what gaps in data or evidence arise in having agreed definitions. So, as many of you would be aware, there is a jurisdictional approach to the authorisation of restrictive practices. That is, all states and territories have their own approach and their own legislation to authorising, so allowing restrictive practices to be used. There is also different legal, social definitions of what is a restrictive practice or when does it arise. There's also a very different understanding amongst the community as opposed to policymakers or governments as to when restrictive practices are restrictive practices and if that is appropriate. So a good example of that is the use of seatbelts in wheelchairs or locked doors in shared living accommodation. So there would be people who would say that a locked door or a seatbelt that prevents a person getting out of their wheelchair when they otherwise would be able to get out on their own is a restrictive practice. There would be people who would say that is absolutely not a restrictive practice and that is just a part of a safe life lived. And so agreed definitions are really important if we want to start to gather data and evidence and make decisions on that data and evidence. I think it's also finally really important when we think about the gaps in evidence and data with respect to the elimination of restrictive practice to think very thoroughly and to a degree research the history of restrictive practice in Australia. There is a very long story to how restrictive practice has evolved, both through disability policy, also lawmaking, but also in community attitudes and expectations, and in particular, in the ways in which families have been supported or not to provide care to their loved ones with disability. And the use of restrictive practice has had its own journey through those areas of policy, but also lived experience. And I think it is really, really valuable for us as a regulator, but also in our role as market stewards and good collaborators of the NDIS ecosystem to have a good understanding of that history. And if you are keen to do research or you are doing research in the area of restrictive practice, I think it is very incumbent upon you to have a good understanding of how we got to where we are today to better lead where we might go tomorrow when it comes to restrictive practice.
What research actually influences reform? What kind of research actually influences policy, regulatory, or oversight reform?
This next question goes to what research actually influences reform and making it really practical. What kind of research actually influences policy, regulatory systems or oversight? But what would you actually use in your role in an ideal world? So what have you observed, Luke? I'll go to you first. And what kind of research helps to drive change in oversight, accountability, or system performance, particularly as you said, when often it's a person by person issue that you're looking at?
Thank you, Luke speaking. Thanks, Mary. It's really hard to say, and I don't want to say everything's important or nothing's important, because neither of those is true. But I think it is finding the right research for the right time. In my most recent major review, which was into child sexual abuse in early childcare, we actually commissioned 4 separate pieces of academic research and then coincided that with roundtable expert input and a lived experience submission process. Because it was such a significant issue, we wanted to not put all our eggs in one basket. We wanted the lived experience voice very loud and clear. We wanted the experts that had worked in the field free to use each other as sounding boards and push for all this knowledge we have built and developed. Why hasn't the world changed yet? What is the new idea that might get us there? And then the academic rigor of what is best practice prevention across the globe? What is best practice response across the globe? What is our current contemporary understanding of online grooming, given that that's a new emerging thing that didn't exist 20 years ago? So picking the right research topic and the right research vehicle for the right problem, I think, becomes fundamentally important. And that's all easy to say when you're in a role like mine, where you know what the problem is you're trying to resolve and you've got a time limit and you've got a budget. If you're an external researcher who wants to do high quality research and shift this world to be a better world, how do you find the children's commissioner or the public guardian or the public trustee or someone in Hope's role who's looking for the answer and is willing to wait the 12 months for you to conduct the research to provide the answer? That's a really complex, difficult thing. So I think ultimately every good idea has its time. And I think that's probably true for research too. So either predict what the world's going to need in 12 months if you've got a 12-month research window, or know that you're studying the right thing. You can clearly see the need for your solution or for your evidence, and have it done and recognise it might sit on the shelf and it might not be picked up straight away, but there will be a time when someone needs it. Which brings me to my most fundamental point I've been trying to do here at the QFCC. We are a commission of 40 staff at the time who were very good at writing reports about what was wrong, what's wrong with systems, what experience did this young person have that wasn't right. We could make hundreds of recommendations a year. Very good at churning out written products. And we then close the project. We scope it up, we do the field work, we write the report, we put it on our website, we close the project. What we've learned is that change doesn't actually happen until you publish your report, and then the slow and steady work of making people aware that it exists, of making people aware of how to interpret it, of going to politician to politician to politician across our federation to find the right doorway in to present the outcomes. We've doubled the length of all our projects because we now see producing the report as the halfway point, not the finishing point, which almost turns, dare I say it, researchers into advocates. If you're going to add that double the length of your project, research is your first half, advocacy is the second half, and that's a different way of seeing the steps we need to take to build a better system.
Hope, I might go to you next. What makes research usable from your lens? What do you actually need to see to be able to act upon the evidence that you see?
Thanks, Mary. Hope speaking. And I'd like to sort of extend off a couple of things that both you, Mary, articulated earlier, but Luke also, insofar as every piece of research will have its time. I think it's really key to know when that time is, Sometimes it can be something that you can predict, and other times you can't, and that can feel deflating, and that you've invested a lot of time and effort into something that might not necessarily be automatically picked up in the way that you had envisaged, or being able to be implemented in the way that you had hoped when you set out to define the research that you're doing. So things that can be useful in being able to ensure that your research has its time and has time sooner rather than later is really being able to consider the landscape in which the research is being conducted. So Nat just spoke earlier about considering the history of restrictive practices and other things. Much of the research that's being conducted in the disability space extends to other things and plays off research or evidence that has come before it. I think it's really key to, and in many ways, read the collective room and the sort of intention or the appetite for the particular research that you might be endeavouring to embark upon. So, navigating different political contexts as a public servant, certainly a lot of my role is about providing frank and fearless advice to government. But if I didn't have an eye to the context politically that I'm working in, I wouldn't be doing my job either. And so being able to give consideration to the time that I'm working in understanding the policies that are being implemented, in understanding the desires and the sort of mandate and environment that governments and others are working in, I think is critically important to ensuring that research has its time and that it has its opportunity to be implemented. Mary, you spoke earlier as well about biting off particular parts, and I think that is also really critical. Sometimes with research that I've seen, it can be really challenging and overwhelming to read research and explore evidence when what's being contemplated is such an order of magnitude that it's really hard to see where the change will be. And so taking off component parts or being able to provide a level of flexibility in recommendations from the evidence that's available, I think is also really key, because that allows policymakers like myself and government masters that we might be reporting through to contemplate how you could make a change based on where you're currently at in a policy or programmatic setting. So it allows you to contemplate small shifts, practical action, tangible outcomes for people where you're not being asked to explore something that might be significant orders of magnitude in one giant leap. And so things where it is closer to being able to make incremental change towards a bigger gain, I think is really where you can start to see research be utilised and used well. I think as well, being able to be a little bit flexible in the way research can be implemented. Again, being able to take elements and translate that into making some changes now, potentially holding things back for another time when the time might be right, and understanding where a policy change potentially in the disability space might not be something that you can contemplate now because there is a change being made in another part of a broader system. I sit in a role where I span across child safety, families, First Nations policy, domestic and family violence, seniors, elders, and there's disability in amongst all of that is thinking about how you can create influence across each of those and where the time is right to be able to make those changes, and particularly where you can leverage change in other systems. So thanks, Mary.
Supporting prevention. How can research better support systems to prevent harm, not just respond after it occurs?
Yeah. What kind of research would help regulators move earlier to prevent harm rather than respond to it? And you did talk about some of the data systems that would be helpful to have, but in terms of what kind of research, whether it's how to change practice, whether it's about education, whether it's about better regulation, the sort of things you've spoken about, what kind of research would help regulators like you move earlier?
Natalie speaking, thanks so much, Mary. It's a really great question. I think the research that can help us move earlier to prevent harm rather than just respond to it is to go beyond the data. So as a regulator, we collect and are getting better at collecting data about the market, about who's in the market, about what they're doing. I've mentioned significantly, and I won't mention again, the visibility issues that curtail some of that. But in any event, we are well placed as a regulator to keep score of the market that we regulate. What though broader research contributors can do is keep us honest but also contemporary in terms of understanding what good looks like, not in terms of some best practice, unrelated to real experience, was once trialed in a very different context, in a very different country, that worked for a very small population group, but instead having research that enables us as a regulator to understand very thoroughly what safety is and what good looks like in terms of safe service delivery. So this is a very evolving concept because the rights of people with disability in Australia are advancing all of the time. I believe they are. And they are increasingly moving such that what good service delivery that was safe looked like 10, 20, 30 years ago is entirely different to what it looks like now. And so research has a really valuable role in feeding that information to us as a regulator so we can ensure that the standards that we set, the quality that we demand as a regulator, is aligned to what the lived experience and real life service delivery wants, and most principally, what people with disability want out of their services, rather than sort of spending decades requiring providers to deliver a certain type of quality service where people with disability are sitting there thinking, this is so irrelevant to me. This is not at all what is good quality or safe service to me. And so I think we have history behind us that tells us how these practices can seem so proper at the time, but don't always age well, or just we find better ways of doing service delivery. And so having that come into us as a regulator can then help us develop frameworks that back that in and require it of providers.
So interesting that observation. You know, I was thinking around some of our research projects that we funded in 2025. They're looking at psychological safety and what creates psychologically safe services as well. And I'm really excited as they're producing some of their final reports that where they're co-designing research, and we had one of them present at and I think Sarah might be here as well, at the Australia's Disability Strategy, which was talking about young people and what makes services psychologically safe for them, because there's different cohorts and different groups as well that need everyone needs psychological safety. But that was certainly something that was, as you were talking about that, sometimes we miss those really soft things that might seem soft, but it's actually how you makes you feel as a person. No, prevention in policy is a hard ask. We know, for example, the dollars spent in health prevention, for example, don't match up to the amount that we spend in intervention and like. From a policy perspective, what type of evidence is needed to support prevention and investment in prevention?
Yeah, thanks, Mary. It's Hope speaking, and I think in that last comment that you made, it hits the nail on the head. So much of the systems that I've worked in, both from a Commonwealth perspective, but also now within state government, we spend quite a significant amount of time in the response or the crisis or the severe end of the system. And often the observation is if we had invested or spent much more time or the same amount of time in prevention, then many of these things could have had an outcome that looks very different. So sitting in a space where I work across disability and domestic and family violence and child safety, much of the time is spent towards that pointier end. And so to your point around how do we reorient the system and how do we move from that sort of severe end in reactive and sort of responding to prevention, really does come down to where is the data and the evidence to make the change? And often, and the reality that working within government is it does come down to where is the cost benefit. So, and a dollar invested in the prevention end could, hopefully translate to, gains in the severe and the crisis end. And so often the research that we need in that space speaks to that evidence of being cognizant of what government will consider and others when making an investment. And so being able to make that case for why investing, and often that can be a really challenging case. I've spent a long time in health as you kind of observed, there is a lot of, and it waxes and wanes. You'll have a prevention strategy one week and it's very different the next. And so it probably goes back to some of that, think about the time as well and be ready for that. But being able to articulate what gains can be made by investing and making the change and making really practical change at the prevention end, and how that will then translate or ameliorate some of the things that you might see in the crisis end, and being able to draw those conclusions, I think, is really at the heart of what policymakers need to be able to influence government to be able to make a change. And so having a really clear and compelling case that supports that is I think, how we will go about strengthening systems, being able to help people do well, support people to make behaviour change if that's what they need, or support them to be able to engage in lots of different ways. Thanks, Mary.
And thanks for that and going off that, because it's something that we think about a lot. There's a history of health economics, for example, and looking at cost benefit analysis, and in the disability sector there's not that legacy of research that really looks at methods around how you measure that cost and benefit that pushes towards the prevention end. So it kind of talks to me of we need sort of research teams to be thinking of bringing different partners in who understand that type of analysis into their research as well. So thank you very much. Luke, last question before we get to the Q&A, and it's kind of adding on to what Natalie and Hope have said, is how can research better identify risks across systems before things escalate? What are some of those canaries in the coal mine, if you like, that could be researched that tell us we're either on the right or the wrong track? Yeah.
Well, great question, and I'll try and keep it really short because I want to get to the Q&As for everyone. But it's a big question. First of all, how do we know what we prevent? You don't know what you prevented because it didn't happen. So in our work, I've tried to prevention must therefore be the act of protection. So we do know what we protect, and then if we know whose job it is to protect children or participants or humans, then we can start to say, well, how good a job are they doing? But also that becomes a pretty big and pretty gnarly question. And in a modern society, I still think there's very much room to say, well, parents protect children, and that's their primary role. And the job of government and systems is to enable parents or to enable family to be that primary protector. But then in the work I've been doing over the last year, particularly around sexual abuse and the increased vulnerabilities of children, people with disabilities, I start to see that people who are charged with protection only protect their bit. So the early childcare company and the members of that board protect children within their centre, or are meant to. The bus driver does it while the child's on the bus, and the regulator, including the QFCC, performs their legislated role for the narrow part of a human's life that they're accountable for. And so that's a very long answer to get to answering your question. How can researchers identify risk? I really encourage you to look at the gaps between systems and those critical points where busy frontline workers decide that it's not their job. The early childcare worker that gets a complaint from a parent about some other parent who says, well, that's between two parents, it's not my job. So I think risk sits in the gaps between people's roles, and what we're seeing in the modern world, aged care, childcare, disability care, every time we try to outsource caring, we create risks, and then we build regulatory schemes and legislation and oversight bodies and inspectorates and data monitoring, and therefore research opportunities, but we don't centre the human. Here's a child with a disability. Who are all the people that should be protecting this human, and how are they all working together to do that? And as soon as you start to look at the world that way, I think you see risk everywhere, because I certainly do.
And people don't live their lives in one type of service. They live their lives in their community with their families. And so that is just a brilliant answer for thinking about, people and their journey across systems, and then how safety can be created in all those systems. So thank you very much.
Questions from you. Concern about who might be missing from the data. Where are the biggest gaps, and what do we need to better understand to improve safety?
Heard a number of questions about safety for specific cohorts. So people with rare conditions, people with complex needs, deaf, blind people, and a concern about who might be missing from the data. And I guess from your perspective, where are the biggest gaps, and what do we need to better understand some of those cohorts that perhaps might get missed?
Thanks, Mary. Hope speaking. This is probably going to be an entirely unhelpful answer, but often if I think about the way in which I, as a policy maker or people who, or someone who tries to influence policy at least, I'm often contemplating policy in a very broad brush way. So I'm often thinking about it, any program or policy or system redesign as responding to a sort of a not necessarily homogenous cohort, but a cohort that looks very similar to each other. And so it's often not until there will be a particular question raised or an issue arise or something where people talk about the rub between different systems that I then have need to contemplate, well, what does that look like? So where is it that, I might have need for a very particular piece of advice? And so it's often not so much in the broad, but when you contemplate nuance and need to look for particular things, that you go and do that looking for, a particular cohort or how, I might need to consider a policy that recognises lots of different intersectionalities, and we touched on earlier about considering whole people, and that we don't just operate as gender or diversity or disability. We operate in our communities as whole people, and so often as policymakers we're considering the whole and not necessarily drilling into the component parts. And it probably goes to some of those earlier conversations that we've had in this forum around being able to do that research and have that information available at a time when a policymaker like myself or others might need that, and can be able to know where to go and draw upon that evidence, because invariably it will come, and there will be need to look at drilling into specific cohorts to shape program and policy design. So potentially as well, take advice from researchers about, well, where is the evidence gap, and what are you seeing in terms of the information that you've got available to you? I often won't have capacity to be able to do that and to look across. And so that's when you have need to draw very quickly on evidence from others who have been able to, review data in that way, or review evidence to be able to identify those anomalies.
Let's circle back to you again, Hope, just kind of extend that question, because it sounds to me, obviously when you're making big policy, you're thinking about big groups, but it's when the implementation falls over, when it doesn't work for particular groups. So it might work for some people in some context. Does that mean that the type of, if you research that you might be looking for is, government's got a policy direction, they're going to implement it, how research that talks to, well, how is that going to be implemented for different groups, and what do you need to think about for different groups like First Nations people, because sometimes you're right, the horse is bolted, a decision's been made by government, they're going down a certain track, they're going to be going there for the next 3 or 4 years, so you want to make sure it's implemented really well. Is that also a time when you look at, okay, we're going in this direction, we want to know how to implement it well?
Thanks, Mary. Absolutely. And often you don't always necessarily, as a policymaker, get the chance to implement or work on something from its inception right through to implementation. And so those opportunities are often few and far between. And if I think about, a number of things that we're working on in Queensland at the moment, Thriving Kids is one of those, and there are opportunities in that regard. We've got a commission of inquiry here in our jurisdiction that is looking into child safety. And so invariably when those sorts of things come to fruition and there's advice that comes out of them, you do need to contemplate how to implement the recommendations or the evidence or the program in different ways. Queensland is a very geographically dispersed jurisdiction, and something that works here in Brisbane will be very different to in Mount Isa or Gladstone or even in the Torres Strait. Yesterday I was with my minister and we were visiting a child safety service centre in Logan, and we visited 2, and one was in Logan Lee and one was in Logan Central, and even the differences in those 2 service centres and the sort of cases that they're working on there are very different, and yet they're sort of geographically close to each other. And so being able to contemplate different approaches in different settings and being able to have evidence available to do that and to make those nuanced changes within broad parameters. So often you're implementing a program which has very fixed parameters, but there are opportunities to nuance and make individual and more localized decisions based on evidence where you have that and evidence for change. So.
Questions from you. There were strong themes around safety not sitting within one system. Where are the biggest risks at those system boundaries, and what needs to shift to improve safety across systems?
In my work, I too frequently see the crossover of mental ill health, alcohol and other drug addiction, and domestic and family violence. So those three monsters plague our society and our family. And so any research I would want to lead in a magical world would be, how do we turn the tide on those three things in a whole of society way? Because they are the root cause drivers of adult adversity, adult incarceration, youth crime, child protection system involvement, underemployment, homelessness. And so driving back to root cause issues, I think, is a critical part. Secondary, and I'm just giving you my shopping list now. Second to that, I am constantly seeing that youth justice and child protection system involvement. We have the lowest socioeconomic postcodes as being the most overrepresented in those systems. So I am personally and professionally interested in the combination of poverty or underemployment and poor economic material basics within a household leading to statutory system involvement and, of course, poor life outcomes. The child protection system and how government and private organisations and non-government organisations raise children always interests me. I don't think we have ever worked out how to do that the way we should. And even that answer escapes me. How can a system reform itself is my underlying lifelong thesis. Where have we seen it happen? There was a point at which I held up the NDIS and the disability lifespan over the last 50 years as, is that a system that's learned how to do good? And I'm not saying that today. But where have we seen a system actually evolve, grow, mature, and improve in a way that we could hold it up and say, hey, all other systems, look at how self-reflection, self-improvement leads to better outcomes. And in amongst all that, I still think we're in a new world dynamic. When I did the child sexual abuse review last year, just the way we parent children in the modern world, I had to spend a whole chapter explaining that the children of today are not having the childhood experience I had or that we had as adults of today. The growth of online environments, the way people are perpetrating harm against children online, the way people are living digitally, two-income worker parents with children in early childcare. The world is changing. And so whilst we might have some pretty good research from 10 years ago, I wonder how much of it we need to pick up again and say, hey, in contemporary times, a digital global economy, does the thesis behind this research still hold? And we're probably at a point where some of the things we hold dear are needing reassessment. And then finally, to close it out, the role of organisations, and I think NDIS, NDIA, the disability sector in particular has taken great strides in organisational accountability for quality and safety. I wouldn't say it's reached the peak of where we want it to be, but in a huge nation with a huge population that's dispersed, we ask a lot of institutions to care for humans and to uphold quality and uphold safety. How do we know which companies to trust? And what do companies need to rethink when they are actually being held accountable for protecting and preventing vulnerable people? And I'll stop there.
Questions from you. Organisations already have a positive duty with regard to workplace health and safety, which includes psychological safety. What can we learn from well-established workplace health and safety policies and practices to support positive change for the safety of people with disabilities in contexts outside the workplace?
Well, we ponder, and in fact, literally last week, had a piece of reform pass the federal parliament that addressed in part this sort of inflection. And that is where we had workplace laws which saw that where a worker was either seriously injured or killed in the course of their duties, would attract a significant penalty in the order of about $15 million. And if that same situation occurred, same outcome, that is, a person with a disability was seriously injured or killed in the course of their service delivery, then prior to the reforms that were passed last week, then the penalty would have been about $412,000. And so the reforms that went through the Integrity and Safeguards Bill were to increase quite substantially to better reflect the value of a life, both for the person with a disability receiving the service, commensurate to the worker who was doing their job. And so I think that's a like real tangible, here's what I prepared earlier, sort of example of how that can happen. But I do have, in the spirit of, I guess, provocation, that we must be very careful around ensuring that we do not get too caught up. And I don't think this is what the audience member was suggesting, but we can't get too caught up in the service delivery workplace rhetoric. And we need to be very clear that services and systems, for that matter, meet people, as we've discussed very thoroughly today, in their lives, in their communities, in their homes, in their places, in their spaces, and at a point in their life which will change and ebb and flow. And so I think there are absolutely good ideas across other systems, but I just didn't want to pass by that inference that service delivery would be inspired by workplace relations, because of course the two coexist very well together for the most part, but I always want to acknowledge that for people with disability that has been a hard-won history, and one that we must always acknowledge the rights of people with disability.
Final question for our panel. If we fund the wrong research, what opportunities to improve safety might we miss? And what are the risks for people with disability if we don't get this right? What would getting it right look like instead? Fund the wrong research. What opportunities to improve safety might we miss? What are the risks for people with disability if we don't get this right? Might go to you, Hope, and what opportunities for reform could be missed?
Thanks, Sue. Hope speaking, and it's a big question. I think the reality is we miss pretty much all of the opportunities. So if we don't fund the right things, then that time might never come to be able to have that research be implemented. And it's not to say necessarily that it will never happen. It's just that time that had been envisaged for that research just might not come if we fund the wrong research. And so then the time might pass, the opportunity might be missed. It might not be something that can be easily picked up and translated into policy and program design. And so I think that then lends itself, extending that out in terms of then that's a risk for people with disability that those changes don't happen because we've funded the wrong research and it hasn't lined itself up with context and with other policies that are happening. So, yeah.
Sue speaking. Thank you, Hope. And Natalie, I always feel uncomfortable just asking you questions from a regulatory perspective. So I'll let you go off-piste if you like. From a lived experience, co-design, or regulatory experience, what does it mean to you? What would getting it right look like for you?
Natalie speaking, thanks, Sue. And I think that all of my colleagues in the Commonwealth expect nothing overly less at this point for me to speak just generally on the rights of people with disabilities. I'm sure that's fine. It is, I've been really thinking deeply about the role of people with disability in substantive leadership roles, particularly in government, but also in civil society, and how that brings us to a different place to what co-design or even consultation has brought us to. And I'm really interested, I guess, entirely with bias, I acknowledge, because I hold a very senior role in the Commonwealth as a person with a disability. But I've been really interested in this very topic and whether decisions made for areas like the NDIS look and move differently when you have, of course, consultation, co-design really baked into what you do. But how different is it when you have people affected by those decisions in the decision-making seat? So if you look at my situation, which is not an overly interesting one, but I should have continued to have my coffee perhaps in a break and I could have come up with a better one. So I am an NDIS participant and I'm totally dependent on services to get in and out of bed every single day. And then here I am holding this senior leadership role in a regulator responsible for determining the quality and safety of services in the nation. And I think it is incredibly interesting to me, perhaps very researchable, so I would put to you, about how we see public policy and law reform move differently. As Luke was saying earlier, we are absolutely living in a different time to what was experienced for families and communities really not that long ago. And these are changes that are structural, they're systemic. So it's really interesting to me in that respect.
I think Natalie has appropriately said it. If there's any concluding comment from me, we probably haven't touched on it yet today, but it's research in strength and brightness, the celebration of where things are safe, bright, happy, shiny, thriving. I don't think we do enough to say, look at these amazing people. What was the strengths in their experience that we should seek to replicate? And so I'll finish on that. There are amazing, wonderful stories to be told. And I wish my job had a bit more of collecting those stories in it. It doesn't, so I seek it out in my private life.
closing and next steps.
I guess in summary of what I've heard, particularly from you, Hope, is around stepped change rather than revolution. You know, governments won't be able to dismantle a whole system and replace it with a new system overnight. I heard from Natalie and Luke, you know, the history of how we got to where we are is absolutely crucial for understanding where we need to go in the future. But the environment is changing so rapidly that we need to take into those environmental situations. I think a really big thing that came through, particularly in safety, is the gaps between systems, and that there needs to be research that looks across those gaps and where it might be working in one system but falling down in another system, because people, as we say, don't live their lives in a service or one system. And I think, Natalie, your closing remark around the role of substantial leadership of people with disability really hits on the very heart of what we're trying to fund in terms of the type of research that we'll fund, that people with disability do have substantial roles in shaping the research, designing the research, in the governance of the research, in designing the methodologies, because they know what will work in the context of their own lives. So I really want to thank the three of you, Luke, Natalie, and Hope. I've absolutely loved this conversation, and I know our audience has. We're getting some wonderful comments in the chat.